Welcome to Tech Smarter. My name is Abby Ritchie. I am the tech guru at the Smarter Service, and you can find me right here every Wednesday talking with people who are engaged in AgeTech innovation. We meet and discuss with senior living operators, investors, and innovators. Everyone who's changing the face of aging services. It's a really exciting place to be with so much innovation occurring. Before we bring our guests on, I want to thank Leading Age Arizona for sponsoring Tech Smarter and to the Smarter Service for producing this episode. And if you happen to be a senior living operator and you're struggling with getting your residents the kind of tech support and education that they need and deserve and are expecting these days, we want you to go ahead and reach out to us because we have professionalized this service and it is so much more than merely tech support. You can always connect with me on LinkedIn for more information. Now, today, before I bring on my guests, I just want you to envision this scenario, because we're talking today about data-driven physical therapy, about biomechanics, and we're talking about intersecting this with age tech and impacting many people that you're with on a daily basis. So most people, when they think about physical therapy, they picture clipboards and resistant bands and an hour-long visit once a week. But what if joint health was being tracked, protected, and personalized in real time, right in your own living room? Well, that is exactly what my guest has done. And I want to go ahead and bring on Dr. Daniel Cottmeyer. He is a doctor of physical therapy and PhD researcher at Georgia State University and the head of physical therapy at Arthroba. Doctor, welcome to Tech Smarter.
Thank you so much for having me, Abby. I'm excited to be here.
Yeah,
that was a great intro, by the way.
Well, thank you. Thank you. I appreciate that. I before we hop into things, I would love a quick story about how you came upon this field and how you were able to innovate in this particular way.
Yeah, I've always been a person that really likes science. And as I was kind of trying to think about, what I wanted to do, when I was younger, what I wanted to do when I grew up, I decided I really wanted to go into healthcare because when I was in high school, I was kind of grew up as an overweight kid. And when I was about 15 years old, I lost about 100 pounds. And that was kind of the first time in my life where I had adults, seeking my advice, people saying, "Oh, wow, you did something really cool. How do you do that?" And I found that I really liked that feeling of having a skill and having developed a skill that, the adults in my life and that people would look up to me for and, seek my advice on. And I could really use that skill to make an impact for others. So that's how I came across physical therapy. And then when I went through my undergrad and then my grad school at Georgia State University to get my doctor of physical therapy. And when I started practicing, I realized I really like being able to have an impact on people's lives, but being a clinician really only allowed me to impact one person at a time, which is a really, great benefit. It's a really great skill to be able to have to see the person in front of you and to help them with their problem that they're presenting with. But I really wanted to say, how do I scale my impact so that I can help more than just the person in front of me and help people across the world who are struggling with a lot of these problems? Because musculoskeletal pain, it affects everybody. You ask anybody, they probably know somebody with back pain, knee pain, ankle pain, etc. And a lot of people aren't getting to physical therapy. So I thought, how do I help people beyond the ones that are just showing up to my clinic? And that's kind of how I got into PhD research and eventually entrepreneurship with Arthroba.
I absolutely love that. So many people I have the honor and privilege of working with in this area have created innovations such as Arthroba, and it is just it is such a delight to see how many lives are being changed and improved, just by taking it out of those four walls of physical therapy. I have had the opportunity to work with people who have redefined the walker, right? Like it's traditional walker, so that it can gain the set type of biometrics that Arthroba has been able to do as well. And it's like, it's a continuation of care, and really a way that you can track improvement and metrics outside of the weekly appointments. Now, nothing's going to replace those weekly appointments, but this is a way to enhance and improve healing and recovery, don't you think?
Yeah, I always like to say with technology, it's about expanding the human factor rather than diminishing it, right? We're not creating this technology to take away from the unique human impact that a great clinician can have. It's really about expanding the humanity of it so that the clinician can focus on really helping the patient get better, and the technology can facilitate that, whether it means providing better care, providing better metrics, or providing better accessibility, because not everybody can get to a clinician, right? So it is great. All these technologies that are being created in health tech, age tech, et cetera, that are really expanding the way that we as clinicians can operate.
And when we're thinking about a clinician visit, because part of us will think that an in-person visit is always the way to go. But what is something that an in-person clinician might just miss during a session that perhaps a wearable sensor catches instantly during a normal day of life?
I would say it's not so much about clinicians missing things. A lot of times you see a clinician that feels, they have a really unique and well-developed subjective clinical sense of these metrics that we would like to objectively measure. But the problem when you get the clinician who just says, "Oh, well, I can tell when that patient is off, or I can see when they're moving inappropriately." One is that the patient isn't always aware of that. So you talk about some of these metrics, if it's inflammation, movement patterns, all these things affect care. And a clinician can usually pick up on these just visually or through feel. But a lot of times, if it's not actually measured and you can't put it out in a number, then the patient isn't aware of it and they can't really see what's going on. So they don't feel that they're well involved in the process. So that's what we're trying to do with Arthroba, is develop a way that we can make those metrics visible so that both the patient and the clinician are involved in that process. And when the clinician sees something, they can point to an objective chart, metric, whatever it is, and show the patient, "See, this is what I'm seeing, and here's how you can see how it's tracking, and here's how it tracks with how you're getting better, and here's how it justifies why we're doing what we're doing." So the care gets better, and then the patient has more buy-in to the care because they can see what the clinician is seeing as well.
Yeah, I love that. It's one thing to collect all this data. It's another thing to interpret it. And so
Hmm.
when you're able to interpret some of that raw data into actionable results and to a daily plan, it makes such a big difference. And I'm
Yeah.
just curious, how physical therapists are able to do this with their patients in just simple, digestible way.
Yeah, so what a clinician will do oftentimes is, so a patient comes in with kind of a vague complaint. They'll say something like, "Man, my knee really hurts you know, my knee really hurts when I jump up and down, or, when I do box jumps at CrossFit, or if
Yeah.
I'm running, a few miles or something like that." And so what a clinician will do is they'll see how the patient's moving. And then so maybe they have them jog on a treadmill for a bit, and maybe they'll take a video of that patient, or some way that the patient can see as well. And they'll notice that as the patient is running, their one knee that hurts starts to cave in a little bit, especially as they get tired. So what they'll do is they'll make that visible to the patient by saying, "Hey, you notice this is about the time during your running when you start to get knee pain. And this is when I can start to see that collapse of your knee. And I know from working with other patients that that collapse of the knee, and through the biomechanics, that collapse of the knee is a lot of times what causes some knee pain, like patellofemoral pain syndrome, or patellar tendinosis or something like that." And so they'll see that objective metric, and then they'll show it to the patient and correlate it with the main complaint that they're coming in with. And that's the way that a clinician creates buy-in with their patient, allowing them to visualize that kind of, like you said, that objective metric that might not mean anything to the patient at first. But then once the clinician makes an effort to link that objective metric with the outcome that the patient actually cares about, that's when the patient and the clinician really become a team, and you can start to make improvements.
Yeah, I can see having, because I have a chronic shoulder issue, like
Mhm.
at some point you just accept that this pain is part of your life and will always be there. And so to have something that's sensing any changes and sensing pressure and perhaps degradation or anything that's just like basically an inevitable part of getting older, but to have something that can pinpoint where that might be occurring is huge and could really change the nature of care in this way. Can you walk us through like a common movement flaw, like knee loading or an asymmetrical gait after an injury, that something that quietly accelerates joint wear and tear if it's not corrected early enough?
So it's hard to say. I'll try not to get too scientific on this
Okay.
one, but one of the things that we see that correlates well after any sort of traumatic knee injury, like an ACL reconstruction or a meniscectomy or a meniscus repair, or even just normal osteoarthritis, you think individuals who have bad knees, is you start to see decreased one, just vertical loading, that the foot doesn't hit the ground as hard because your body is offloading that injured knee. And two, we see decreased loading through the muscles. So we see kind of like this stiffened knee gait. So, a lot of times as a physical therapist, I have an inclination to just get up and start walking, but obviously that won't work on this format. But you see individuals that start to walk with this stiffened knee gait to where instead of getting a little knee bend as that person steps to load their quadriceps, they just kind of lock it out in place and almost walk a little bit like a peg leg. And that gets better as the patient improves, but a lot of times it doesn't recover fully. And you can see that exaggerated if you have an athlete that's trying to get back to pivoting sports or jumping sports. You'll see decreased knee bend during landing or decreased knee bend during cutting. And this indicates that the patient is not really trusting their muscles to take that load again after that knee injury. So the brain is subconsciously offloading it. So with a technology like Arthroba, we could use sensors to sense, okay, how much are you loading each knee during these different tasks, and see, are we getting that recovery? And physical therapists have already been using these metrics in clinic. They've said symmetrical loading measurements as baselines for return to sport, right? We want you to have greater than 90% loading between your injured knee and your healthy knee before you get back to sport. But then, they send that patient off and you never know whether you're getting to 100% or whether that patient is still at 80%, 70%, and if they're actually getting better. So even beyond that care period where you're with a physical therapist, you need to continually monitor and make sure you're tracking towards getting to 100% so that we can prevent risk for re-injury and prevent risk for long-term degeneration like post-traumatic osteoarthritis, which is that, again, that wear and tear of, breaking down the cartilage in your knees.
Yeah, and so much of what I'm seeing these days, whether it's at trade shows or even at CES, the Consumer Electronics Show, are AgeTech, MedTech, health tech devices that are helping older adults live longer and
Mhm.
safer independently. And I'm just seeing so many of these consumer technologies that are really converging to helping older adult to help older adults stay safe. And I'm curious from an entrepreneurial standpoint, how you've been able to market your device and also grow the awareness of it.
So we're actually, pre-revenue with our device right now. So we're actually just in the process of getting this into the hands of consumers. So I don't know if I can give you, too much direct insight into how we've been marketing with this device, but it's been a lot of just getting the word out through word of mouth, right?
Yeah.
Being in the locations where our users will likely be. So, run clubs, the running scene, right? Those are a lot of individuals who have knee pain and would like to prevent knee injury. Um, Now, you said, how are a lot of other companies getting into it? Or, like, how do we, that metric that moves the needle for whoever's buying your technology. And that's kind of where we're trying to find our niche with Arthroba as well, because it's a really cool product and it has great benefit. And now we're working towards, what is that selling point, and who is the end payer that's going to be interested in this.
Yeah, so many of these products also go through the ATC, it's the AARP's AgeTech Collaborative. I don't know if you've
Hmm.
heard of it. And
Yeah.
it provides a great place for, say, a test bed, so that you can test your product before it goes to market and receive certain feedback with the population that you are aiming to serve. And in the case of the ATC, it's mostly older adults, but
Yeah.
within so many of these products, there is always a fine line between the sensors and also preserving someone's dignity. Not everyone wants all
Hmm.
of their movements recorded, right? So,
Yeah.
I'm just curious, how do you balance this kind of surveillance and remote tracking with preserving someone's dignity?
Luckily, I think that's a great question. Luckily, we do not run into that too much with Arthroba, in the sense of not too many people are really sensitive in whether or not, their knee flexion data is going out. Or, Arthroba also measures fluid measures. So whether or not you're having inflammation or muscle mass loss or something like that. Those are important metrics that people don't tend to feel very sensitive about, right? It's like, say, Abby, you were wearing our device and somehow our data got leaked and everybody knows what Abby's knee flexion angle during mid stance of gait is. Okay, probably not going to be the end of the world for you. But I do talk to a lot of companies that deal with that, especially when it comes to older adults, because a lot of companies, they can see the older adult as a metric and don't really respect that this is a human being behind the technology that you're working with. And I think, I talk to a lot of entrepreneurs, and preserving dignity is one of the most important things that you can have as a goal when you're creating an age tech product. Because as older adults, they get into this age where people start disregarding them. They start to lose their dignity. People just say, if you're in a hospital, somebody's going to watch you in the bathroom. Somebody might watch you in the shower. It's like, you don't want that, right? So a lot of technologies that are trying to circumvent that, some really unique solutions I've seen are, shower sensing technologies that don't capture any video, any recording whatsoever, but just use motion sensors to detect falls or shakiness or unsteadiness, right? Something that provides a call button so that you can get help if you need to. And this way, we're not violating the older adult's privacy, because we're not taking any videos or anything in the shower, right? Which is a high risk for falls, but also a really sensitive spot. But we are able to capture that metric that matters, which is this person safe in the shower? Another thing I always like to add is that the right technology can even increase older adults' independence and dignity. So, in the sense of kind of the classic method, in a more family-oriented culture, of monitoring your older family members, I'm going to check in on you every day. Maybe you move into my house with me, right? If mom's feeling like they're unsteady, or I don't think they're going to be safe in their home, you got to move into my house so I can keep an eye on you. And older adults don't like that either. So when you get the right monitoring technology, yes, you're capturing more data on that older adult, but you're allowing them to live in their own home by themselves longer, which is ultimately what a lot of older adults want. So I like to kind of flip the script on the conversation and say, technology isn't just about monitoring the older adult and keeping more tabs on them. It's actually about going the other way and making it so that the adult has less monitoring, less oversight, and more independence, while also being safer on the other end, because you have these kind of in the background objective metrics that can get the caregiver what they need without having to be hands-on.
Yeah, we also experience some of this at the Smarter Service when we're helping older adults with their technology, for instance.
Mm-hmm.
And the way that we're teaching technology to an older adult with an older adult is vastly different from how technology is presented to someone who's a business professional.
Mm-hmm.
And a lot of times, there can be a myth that an older adult can't learn, doesn't want to learn, doesn't
Mm-hmm.
have the capability, but that's really not the case. And we're
Especially not now.
no, especially not now, but there is
Mm-hmm.
still a prevailing myth. And so we do work really hard when we're educating to preserve their dignity,
Mm-hmm.
and not try to like dumb it down, but meet them where they're at.
Yeah, that's a great element of preserving dignity, because it's not just about does the product preserve dignity, but is the way that we approach the older adult with the product preserving their dignity. So like you said, we're not hand holding you and taking the assumption that you can't handle the information that I'm giving you, or you can't handle change, I'm going to come into it assuming that you are smart, you are capable, and you are. No, it's not so much to me a balance between, wearables and the treatment. They actually can go hand in hand. So a technology like Arthroba, right, which can sense inflammation, it can sense improvements in muscle mass, and it can sense improvements in joint motion. That's a really good way to monitor whether these sorts of injections and these, newer kind of trendier therapeutics are actually working, right? So you imagine if we're unsure, so say you're a physician and you've seen the research on stem cells and it's promising, and so you've been doing some stem cell injections for your patients, but after you give them the injection, you don't really have the metrics to tell, because if you're a well-meaning clinician, you want to know whether the therapy you're providing is actually working. And so Arthroba can come in there and say, okay, after you've had this injection, we can see an objective decrease in joint swelling. We can see an objective improvement in your movement patterns. We can see an objective improvement in your daily activity and your muscle mass after we give you this injection. So in a way, the wearable sensors are going to only improve and shed greater light on some of these novel therapeutics coming out, as far as, the regenerative therapies, the PRPs, et cetera.
Are there any particular hurdles that you've been having to overcome time after time after time when you're trying to convince traditional healthcare, for instance, and insurers to adopt some of these sensor technology options instead of just sticking to standard care models?
Yeah, one of the biggest things that we run into, especially coming from the physical therapy field, is that the payment incentive is kind of perverse when it comes to physical therapy. So, physical therapists get paid for keeping the patient in the clinic longer, right? So if you're, just thinking as a business person and you have a patient coming in with knee pain, the best thing that you could do from a business perspective, just one-to-one, is I'm gonna keep this patient in here 3 times a week for the next 12 weeks. And then I'm gonna get my money from insurance and I'm gonna send that patient on their way. It doesn't pay physical therapists for getting the patient better or making sure that the patient had a great experience with physical therapy. So you can imagine the flip side. If I'm a miracle physical therapist and every patient that comes into me is getting better in, one day, a single visit, I wave my magic wand and make their knee pain go away, that's terrible from a physical therapy business perspective, because that patient, they only get paid for one visit, right? The one visit that they showed up for. So that's our biggest hurdle, is finding out, so Arthroba can decentralize that process and say, instead of having that person come to the clinic every day, they can do their therapy at home where they don't have to drive an hour. Maybe they don't have to get daycare for their kids. They don't have to secure transportation, right? These are all great things for the patient, and these are all great things for us as clinicians. But trying to figure out where that fits into the actual physical therapy payment model, given that physical therapists get paid for, patients coming into clinic. And, one of the ways that we've been able to get around that is, there's a lot of great cash pay clinics that, they really stake their reputation on getting the patient better and getting the patient the most bang for their buck. So in that way, Arthroba can be really beneficial there. Also looking into remote therapeutic monitoring codes, because CMS and other insurers are now paying for remote therapeutic monitoring services. So if we can utilize Arthroba to capture some of those billing codes, that's a way we can get around this payment model. So just getting a little bit creative while sticking with the mission that we do have a product that can get people greater access to better care and give them just better insight so that they can manage their own health without having to go constantly to a clinician.
So let's say, speaking to someone who is over 50, what would you say could be one of the most impactful things they can do to protect their knee and joint health?
One of the biggest things I would say is just educate yourself. So look into resources on what makes knees break down over time. I have a little blog where I like to post stuff and talk about that sort of thing. But any resource that you can have to say, what's going on inside my knees and how do knees break down and how I can prevent that. So just getting that little bit of education goes a long way. And there's even been scientific studies to show this. But I know that's a little bit of a cop out. So I'll give a more, direct answer to that. I'd say if there's one daily activity that you can do, it's just stay moving throughout the day. So even if it's, commit every day to going 30 minutes, 60 minutes on a walk. And if you want bonus points, spend 2 days a week, 30 minutes in the gym doing some resistance exercise. So really working the muscles of your legs is going to work wonders for preserving your joint health. The myth I want to address here with this question is the myth of wear and tear. It has been, especially amongst older generation, everybody thinks the more you use your knees, the more they break down. They think of their knee cartilage like brake pads. The more you use them, the more you're just going to wear down that cartilage until it's eventually nothing and you have to go get a knee replacement. That's not how knee health works. We've done a lot of research to find that just like your muscles do, right? When you work your muscle, it gets stronger. Cartilage does that too, to a lesser degree. So in order to keep your cartilage and your knees healthy over time, you have to use them, and you have to use them frequently. And you honestly have to use them to a degree of intensity, right? You have to strengthen them, make sure they have great balance. Things like that would be what I would encourage most people to do, is just adopt a regimen of daily activity and keep your knees moving and keep yourself healthy. And that will keep your knees healthy over a long time. Don't think of it as wear and tear. Think of it, I'm going to develop these knees and keep them healthy for a lifetime.
I love it. Is there anything within the AgeTech space right now that you think is overly hyped?
Oh man. I always I'm so cautious. I don't want to talk down on anyone. So overhyped might be tough, but the one thing that I would encourage people to be careful with is, AI, obviously. That's, I think, the common target, in that it's obviously AI is getting a lot of well-deserved hype. And I think it's really going to change the game for a lot of these age tech solutions. What I would caution new entrepreneurs with, or, even senior living operators or other, individuals in the age tech space who are looking for technologies to adopt, is be careful with these just packaged up, I'm going to put a wrapper around ChatGPT and just send that out, right? From an entrepreneur's perspective, you don't have a really good moat with that, in the sense of, can anybody else just replicate that if you're just putting a package on ChatGPT? So if you're going to be using AI for an age tech solution, make sure that you have something that makes your solution truly unique, instead of just creating the simplest AI solution and putting it out there, right? Really think of, how is this going to, like we talked about before, how is this AI solution going to expand the humanity of how we interact with older adults, rather than contract the humanity and take away from that human interaction?
Wonderful.
So I wouldn't say overhyped, but possibly in some situations, people are taking it too far.
I gotcha. I hear you. Daniel, how can people connect with you for more information?
Yeah, Abby. So you can follow me on LinkedIn. It's just Daniel Cottmeyer. I have a pretty unique name, so if you search that, you'll probably find me. I have a website called drdanielcottmeyer.com. You can also look at our website, arthroba.com, and I will shout out AgeTech Connect, which is the organization that I'm pretty heavily involved in. We run a podcast there, so if you like the content that Abby is putting out, you'll probably like the content that we're putting out as well. So if you search AgeTech Connect on YouTube, you'll find our channel, and you'll find me having more conversations like this with people like Abby. So I connect with me a lot of different places, but feel free to reach out. I'm always very responsive, so I'd love to chat with anyone.
Yeah, I'm a huge fan of AgeTech Connect. Thank you for mentioning that.
Mm-hmm.
And I want to thank those of you who are viewing this today. Thank you so much for your participation. It just means the world to us. And thank you to our sponsors at Leading Age Arizona. And we will see you all back here next week. Bye.
Thank you, Abby.